don't be afraid to speak up. If you are asked questions, even if it's just by a colleague, to say, hey, what do you think of these guidelines? Or what do you think of this? Being able to say, not just say, oh, I think it's fine, but honestly saying what you think about it, because you never know where that's gonna go. Or if you have an opportunity to speak to people involved in making these or changing these, speak up, because it's not gonna change unless we group together and speak up about it. And then the other half of that advocate piece would be to advocate for your patients. So if you are coming up against a barrier, say an insurance company, not just washing your hands of it, but going through the steps that they're asking you to jump through and giving the rationale and the documentation and all of the things for why you think it's appropriate to continue that person on whatever they're on, and not just saying, oh, well, they said no, so I guess we're done. So just really taking an active role and making sure we continue to do the right thing. I see so many silos, and if we can't start working across, we can't make progress either. And so if you have a patient that you're caring for, I'm in the hospital. So if we're in the hospital and we're caring for someone and we know that they're in a pain clinic, I'm not just gonna assume the pain clinic's gonna take back over what we've recommended to have done. I think should fall on us to make that phone call and say, hey, don't know if you knew this, your patient's here, here's what's going on, here's the changes we're hoping that you will continue. What else can we give you to justify changing the plan you may have made? Also, making sure we collaborate with them, because a lot of them have contracts, and if a patient goes outside of what the prescribed things are, they can be discharged from the pain clinic. And I would never want someone to lose their pain provider because of something we change in the hospital and just don't give the professional courtesy of that extra phone call to make sure we really make the smoothest transition we can. We're finding that medical schools, pharmacy schools, nursing schools, we are finding that it's not taught the best. Maybe they have a little bit on it, but not as much as what you might need. And so there's a gap. There's a knowledge gap out there that I think we need to fill. It's gonna take some work, but I think if we all work together and develop some things and emphasize, it goes back to the advocating for education so that people don't feel afraid to do things, because if you're not taught well, you're never gonna do it well, and you're gonna be afraid and you don't wanna try. So I think it may seem basic, but sometimes that's where you have to start. I think it's a combination of both, because you have to have a politician that will listen to you, but you also have to have physicians, pharmacists, nurses, other people that are willing to go testify to get the policy changed. So it's another collaborative practice for us to engage in. It's not going to change by itself, and politicians are politicians. They're good at doing that. They're not the clinicians, so we have to share with them what we know and how it's affecting people. I do think we need more people in politics that have some more healthcare background, just to make it not quite so, oh, I can't think of the right word, have more representation of many different backgrounds so that you have lots of input on whatever policy you're trying to drive. I mean, I think we need more people with military backgrounds to drive some of the other policy. I think we just need a wide array of experiences for that.